Thank you, everyone, for joining us today for the CTSI's Translational Science Seminar Series. Today, we are offering a session which will provide an overview of the Lion Mobile Clinic Initiative and ways in which service, research, and teaching have been integrated into its operations, including the CHEER initiative and future plans. So with no further ado, I'd like to make introductions to our presenters today. Dr. Michael McShane is an assistant professor of medicine in the Department of General Internal Medicine. His research, teaching, and service interests intersect in creating curriculum that is responsive to community needs, particularly for underserved communities. And Jess Abrams Schrodel is a research project manager for CHEER at Penn State College of Medicine. In her role, Jess strives to create meaningful connections between community members and researchers that promote equity in healthcare in under-resourced communities to reduce health disparities. So I thank you both for all the preparation and for what you're about to talk with us today about. And with no further ado, I'll hand it off to both of you.
Awesome. Thank you, Ellie. And thank you, everybody, for joining. Some great familiar faces and names, so I appreciate folks joining in. Let me go ahead. I'm going to share my screen here, pull up a PowerPoint slide that we have. Okay, and yeah, so really appreciate everybody joining in. I hope to, so I think this initiative is relatively new, and so as much as today sharing what we've been able to accomplish over the past 2 years, I think really hope to use this opportunity to hear other ideas, suggestions, ways that we can help to move it forward. And some of that goes to the significant need that exists in some of the communities that surround our campuses. And so if there's ways to figure out ways to integrate research, service, or teaching in that, then we're open to ears and suggestions, and would love to hear what people's thoughts are. So I'll just start by giving a brief primer. Some of you may be familiar with this story. So on the left is a picture of Snowshoe, Pennsylvania. It sits right off of I-80, just north of the Penn State main campus here in Center County. As you come off of 80 exit, there's this sign, or there used to be this sign that existed that said Hall's Supermarket, True Value, and Subway. And just a little bit farther down the road is where the main medical center was, the Mountaintop Area Medical Center. Around 2020, so Snowshoe, like many other rural communities, was in steady decline. And then it got hit hard by a series of events. First, Hall Supermarket, which was the only remaining supermarket in Snowshoe, burnt down. With it went the True Value and the Subway. Soon after, there was a bank that sat in front of it. It left town. And then just down the road, there was a pharmacy and a medical center. Unfortunately, the pharmacy also shut down. And then soon after, the medical center couldn't cut it and also shut its doors. So within the span of about a year, this community lost a grocery store, hardware store, a bank, a pharmacy, and a medical clinic. And so it was a community that was hit pretty hard. So us at the regional campus sort of saw this happening in real time, and we're trying to strategize about ways that we could help with the significant loss of infrastructure that happened in that community. And at the same time, many of you may know the regional campus really was based on this idea of helping to provide hands-on experience, provide students with opportunities to provide high quality of care to underserved populations. And so we saw a potential genesis and an idea to kind of merge those two needs. So we looked at different models, one of which was mobile health units, which exist across the country as a way to increase access in at least some small way for that community. So we had conversations with people from the community and also from PSU about how to do that. And so we really landed on this mission. And I'll highlight the true north of this initiative has been really to help rural and underserved communities in whatever way that we can, providing high quality care, healthy food options, and also trying to explore economic growth and development for those communities. So in 2022, we launched this initiative, and I sort of term this as a rent to buy model. So as many of you may know, mobile health units can be quite costly, upwards of $500,000 for new rigs, and some even more expensive. And so there happened to be a healthcare institution called Evangelical Community Hospital in Lewisburg, Pennsylvania, which is relatively close to State College, which had a mobile unit that was not being operated. So we partnered with Evan to essentially rent their mobile unit and take it to Snowshoe at a frequency of 2 times per month. Since then, I list here, we've been able to expand to other locations around Center County. Our initial services that we offered were focused on prevention. So blood pressure screens, different preventive screens, flu shots, COVID boosters. And then we've expanded. So we've partnered with Center Volunteers in Medicine, which is the remaining free clinic in a Center County to provide primary care services for those in need, home visits, and then a health literacy initiative, as well as other initiatives that have been focused on providing different resources to that community. The mobile unit, we've been staffing it with medical students, graduate students, undergrads, faculty, and community partners. So here's a couple of photos of the unit. So this is the one that we're currently running from Evangelical. You'll notice they have some vaccine fridges here in the top left corner. There's an exam room that you can kind of see with the right-hand picture and the bottom picture. And then here's just photos of us at various events across Center County in different seasons, students that have been involved in those different events. Some of which have included different vaccine drives, where we've had people drive through at food distribution events to deliver food and then also provide flu shots. We have also had a couple events where we're at events, but not with the physical mobile clinic. So you see the bottom right-hand corner, which is a sort of way we've been doing different outreach initiatives. So I'll share just a little bit of the output that we've been able to accomplish over the past 2 years. And I'll sort of describe this in sort of the overlap between service and education, service and research. And because I think where a lot of this is intersected is really trying to find align what's a educational mission with service opportunities within the community. So we've been hosted over about 81 events over the past 2 years. Provided a significant amount of time for direct outreach to the community, and then provided as listed there the community benefit on behalf of Penn State Health. We've also been able to integrate different courses and requirements across different colleges within the university. It's a way to try and align the different service opportunities with educational missions. So this is just kind of an overview of some of the opportunities that we've been able to sort of develop in that lane. And so this was an article that we published early on, and I think I wanted to highlight one of the important aspects that I think kind of is in with this lane of service and education is the concept of proof of concept. So with the upfront capital that is often required for mobile units, I think we really dug into this concept of how can we demonstrate value early on to demonstrate a proof of concept to expand further and think about having something that would be not necessarily rented, but owned by the university. And so this was an article that after our sort of initial offshoot of it, we found that, sometimes that proof of concept had been really valuable and for us to collect some initial data and demonstrate that this is something that could be sustainable and would be a worthy investment for the future. And then in terms of service and research, I think it's been remarkable the different colleges that have been willing to help out in either some of the service delivery and in turn some of the research. We've talked a lot about the importance of leading with service. And I think that has really rung true that over time it takes a significant amount of time to develop trust within the communities that we're going to. And so I'm trying to think about ways that we can first lead with service and then integrate different ways that research can help sort of with the service delivery. And I'll show an example here of, I think, some of the what we really were able to determine early on. So we were, when we launched the mobile unit, we had a rural sociology team that was embedded within the clinic. And what was really valuable for us is that as we were delivering services, the rural sociology team was talking to patients, talking to community members, talking to those that didn't approach the clinic to really understand ways that it should be adapted or modified to meet those needs of the community. And this was a paper that we published recently that described probably the 4 main challenges and adaptations that we made. And I think probably one of the biggest ones was that it can be intimidating to approach a mobile unit. So much of the programs that we initiated were events where we came off of the mobile unit and provide different educational resources or even flu shots off of the physical mobile unit and sort of meeting the community where they were located. And so I think that really helped us gain some additional trust within the community and adapt to those needs. And much of that came from conversations that our research team had with community members as we were on the ground and meeting with them. So we just highlight here some of those key adaptations and challenges that we noticed when we were first doing this initiative. And then I think one of the things from an educational and research perspective, we've been really trying intentionally to think about ways to align our students with community needs and projects that develop. And so this is sort of just some of the description that we've been able to do. We've had a lot of different projects with students that are focused on health literacy, social isolation, just different projects to help to align some of their great skills with the needs of the community. And so as we look for the future, I think how we sort of see the mobile unit developing is in the lane of thinking about it as a mobile classroom, as a mobile research hub, and a mobile service unit. And so, it's not surprising that much of the needs that we're seeing in the community go beyond healthcare access and quality to the built home environment, to food insecurity, to other needs that that community needs. And so where we have sort of shifted is to really think about in what ways can partnerships within the university and community-based organizations be able to fulfill a need that may exist in the community. In addition, I think we really view this as we're developing trust within the community as a great opportunity for engaging local communities in their challenges and align that with different research interests in order to help them facilitate further needs within the community and really sort of connect researchers with those within the community. And then finally, we see this mobile unit as a great classroom to provide students with opportunities to work with community members across the community. We also see it as a great opportunity to be a classroom for the community. And so thinking about ways that we can provide educational resources and opportunities for communities that may not be able to make it to a physical Commonwealth campus or other location, other classroom that may be part of our institution. And so that brings us to where we're going. And so I share this as the direction of what we've been able to accomplish, but then also I think the opportunity that we are going to have in short order of thinking about the infrastructure that will exist. So we were fortunate enough to get a grant through the USDA for the purchase of additional units. So we are in the process of building 2 Airstream units, a flying cloud and a base camp, and I'll show some pictures of that. And then 3 vehicles that will sort of expand the fleet that will be Penn State branded and be available for that mobile classroom, the mobile research center, and mobile service unit. And so here's just kind of a thanks to marketing for sort of mocking this up, but just an example of the Ford F-150 Lightning that we'll be working towards. And then here's the 2 Airstreams. So the top left is the base camp unit and the flying clouds, the bottom right-hand unit. The plan is to have these not wrapped initially and then partner with different communities to help with the design of it so that it's sort of designed for the community and by the community. And here's just a little mock-up. So this is the base camp unit, which is the smaller unit, have 1 exam room, and then you'll see it has a refrigerator and a bathroom and some extra storage space. And then here's the base camp unit that will have 2 exam rooms, a bathroom, and then some additional storage space. They also have an outward-facing TV and speaker system, so for any educational outreach that can happen outside of the unit, there'll be some built-in infrastructure for that too. And so I think really this sort of points to the future. I think we sort of see this as the mobile unit has the potential from a research opportunity to be a mobile clinical research center. So University of West Virginia recently was able to get a grant that has a mobile CRC. And so similarly too is the possibility that a mobile unit for Penn State University could be a mobile CRC for different research opportunities. I think there's huge potential for cancer screening outreach. So we do a little bit of that and are continuing to do more this summer. And so again, could really serve as a great opportunity to do outreach for cancer screening in rural communities. And then additionally, we see this as a potential hub too, where places like Snowshoe, where community centers and places for people to connect have gone away for various reasons. This is a great opportunity for people to connect and provide a space or a hub for community-based participatory research. And so we think that this could be a really great opportunity to utilize that space for it. All right, and so I'm going to turn it back over to Jess to describe a little bit of the Cheer initiative that's been a part of this movement towards providing research opportunities to rural communities as part of the mobile clinic.
Thanks, Dr. McShane. Hi, everyone. I'm Jess Abrams Schrodel, and I'm here representing the CHEER team. We're the Community Health Equity and Engagement and Research Program at the College of Medicine and CTSI. So we had the thrill, really, and honor of working with Dr. McShane in this awesome project. What we've been able to do is through using the mobile health clinic, we've been able to piggyback off of the clinic health screenings and community events to bring actual research studies, flyers to the community. Rural communities, as we know, they're underserved with healthcare, but that also ties into research as well. There's not a lot of access for a lot of rural folks to have opportunities to participate in research. From the start to the end of the research process, it's difficult. There's a lot of disconnect there. So what we're able to do is bring research opportunities to the community. You can see a few of the flyers that we've shared with community. The nice thing is we can kind of personalize the community members to the research projects and really kind of figure out if we're going to a library, for example, where we can anticipate moms and dads and young children and some elderly folks. And then when we go to the senior center, we know there's going to be more of the elderly attending, and we'll specifically target the studies that would best meet the populations that we're going to be working with those days. What we're hoping is for future plans is to expand the catchment area. And I think there's actually a question about that in the chat that maybe Dr. McShane might be addressing, I'm guessing. So we're going to hopefully be expanding the catchment area to share IRB approved research advertisements at already scheduled events, and then also enroll participants in minimal risk studies via e-consent and conduct study visits on the Lion Mobile. So we're thinking surveys, things like that, that we'd be able to actually conduct at the unit. And if anybody is on listening today here to the webinar, you're more than welcome to reach out to us if you would like us to share study flyers with rural populations when we do attend the mobile health clinic. There's just a few steps. First, you have to make sure that the IRB did approve the study, of course, and that it's been approved to specifically distribute in community locations. That's an important part to remember. We also asked to just meet with the team, the research team, just for a few minutes to talk about any specifics and make sure we have a clear understanding of the study before we start distributing them. You can send 100 approved flyers to the address listed there at University Drive. If applicable, we asked if there's any support groups or community give back type programming involved with the study, that if we can be aware of that so that we can talk about that as well with folks in these rural populations that we're going to. And then we also really appreciate when research teams are able to track how the potential participants found out about the study. Specifically, of course, we're looking for the mobile health clinic and anybody who would be coming to the study from the mobile health clinic.
Thanks. And I'll say just to, so we've been fortunate enough to, be on this path of building up the infrastructure. And so we're currently in this rent model. The Airstreams are, are in the process of being built. And so I think it's the likelihood is that we'll have 2 new units, the Airstream and the base camp and the Flying Cloud in the fall of 2024. So my hope is that, this is such a important resource that it can be utilized across the university. So that includes at different Commonwealth campuses as well. And so I think there's real opportunity to, think if we have these units out on the road 5 days a week, what does that look like? And, how can we share resources across campuses to have the greatest potential to reach communities that need it most? And so I think we're really interested in figuring out ways to get it on the road 5 days a week, including at the Hershey campus. And so if there's interest in figuring out ways to make that happen, I think we'd definitely be interested in sharing the resource and getting it out as much as possible.
And then our contact information is right there on the screen. Again, if anybody has, for the cheer squad would be the one for if you have any research studies specifically that you would like to be shared. And then the Lyme Mobile Clinic email and website is available as well for questions.
I'm just going to stop sharing, and then more than happy to answer any questions that folks might have.
I have a question. Can you hear me?
Yeah.
Yes. So how have you perceived the reception of this initiative in the community? Like I assume that there is a flyer coming notifying either the leaders or someone around that the mobile unit is coming. And from, let's imagine this 100% population or community sample size, how the reception has been, like how many people go and go there. I'm just trying to see how that works in real life.
Yeah, thanks. It's there. So I feel like there two responses to that I have to that, and I appreciate the question because it's so important. One is, when we're talking about research in rural communities, the N is much smaller, and so when we go to Snowshoe, the population is not huge. And when we go to Howard, same thing. We're talking about the populations in the thousands. So the N is not a large number. And so from research perspective, it sometimes can be challenging doing research in rural communities to get larger numbers for studies to determine, potential impact. However, I think what we found is that and this is probably no surprise, is that it takes time to build trust. So the community Snowshoe, we were coming in at a time that was a series of significant incidents that happened in that community. But that was a snapshot of a longer history of trajectory of downfall. And we had learned very quickly that from our research team that a community like Snowshoe views almost the structure of Center County as a caste system, where State College is at the top, it gets all the resources, and Snowshoe's at the bottom, it gets nothing. And so there was a significant amount of us coming there as Penn State University of distrust of, is this going to be another thing that comes to the community and disappears? So, it took many months, if not, over a year, really to establish some trust within that community. I think where we sort of worked to increase that trust was really getting off the unit and meeting people where they were located. So we have had a couple of great initiatives at the senior center up there. We've been able to go around town and deliver food to different people. So those sort of getting off a unit, meeting people where they're located had helped. The other challenge that has existed in Snowshoe, but other rural communities, is the limited amount of communication. So when Hall's Supermarket burnt down, within it was a community board. And so people would often post flyers or other information there. There are many people in some of these rural communities, including Snowshoe, that don't have a cell phone. Landlines are the main method of communication, mail as well. And so many people were going to Hall's Supermarket to get information for what was happening in the community, how they could participate in different events. That's gone. So the methods of communication have really have dropped dramatically. And this is no different than what has happened in other rural communities. That there's almost like this as the resources dwindle within it, the community gets closer. So the ties with individuals within the community are stronger. We heard stories of, for example, there was some fresh foods in the Dollar General that was in that town. And people were rationing resources because they would say, I'm not going to shop at the Dollar General because I know someone else might need it more than me. So there was this really close social connection that was happening within, but at the same time, resources and other things that were coming externally were being pushed away. And so there's almost like this pushing away of external resources and this collapsing in of the social networks. And so us coming in really took it took a while to really kind of get more familiar with the community and get more comfortable with it. And there's of course variability that exists within that community, but that was it. So that's a long-winded way of saying that I think, one, there's this challenge from a research perspective of a small amount of N's. So how do you deal with that and collect enough information to have a reasonable story? The other piece of it is that because of what has happened with the trajectory of these smaller communities, is that the sort of the insular nation that's happened with them as they've become closer has also sort of pushed away externally. So it's taken a significant amount of time to build trust within those communities to get a closer connection, to understand what their needs are, and really figure out what's going to be the best method moving forward. Jess, did you have anything else to add for that one?
I think, you're absolutely right that the N is relatively small, right, that we've experienced so far with research. And the amount of distribution and folks that have actually, signed up for different studies through the mobile health clinic. But what I have observed, and I think this is what Dr. McShane really beautifully explained, is that there's this trustworthiness that we are slowly but surely establishing with the communities that we're going to. And it does take a lot of time. These are communities that have been really, really depleted. I mean, they have no resources available anymore. And I've heard from some research or folks that have been interested in research, oh, I did a research project once with Penn State, and they came in and then they never heard from them again. So there's this distrust that we're really working slowly but surely to reestablish. So I hope that kind of contributes to what you were asking as far as the N and how many people we're actually yielding from different events. And then we do go to the events, of course, where there are a lot more folks for a special like community agriculture days and different events in the area. And certainly that yields a lot more folks that come our way. Did you, Dr. McShane, would you like me to read you a few questions that were put in the chat?
Oh yeah, I just saw Ted. Thanks for the comment. I was going to mention something about that too. Yeah, we've been really thinking about, and it's such a good point. So there's so many of these sort of different local organizations. I think the Lions Club is another one, Ted, that we've had conversations with. Is how do we create partnerships with the academic institution and community-based organizations that are already doing great work, and figure out ways to either augment the work that they're doing or support the work that they're doing in some way to help the community. So, for example, Lions Club has this whole system of screening for doing vision screens for pediatrics patients. And so they may be able to screen, but there's no referral system or process set up for, at least for the Lions Club locally, to then take that and then provide prescription lenses for people. So there's some of this like, well, gosh, it feels like we should be able to figure out a system to do that. Similarly too, there's we've been working on a community garden, and there's a 4-H club that is willing to help pick weeds, as part of their community service requirements. So I think what a lot of the times what we're doing from a service perspective is really trying to figure out ways that we can leverage the academic partnerships and community-based organizations to sort of extend the work that they're doing and focus on the challenges that we're finding when we go to these communities. So I think that, Rotary Club is another great example. It also then leads to this, perspective is, can we then highlight different challenges that are happening in communities and community-based organizations that are working on that researchers may help to provide for further grant support or whatever it may be. Another example of this is the local habitat group had started up a program here to help with home repairs. And it was, I think it was something over $1 million that they were able to do. And within the span of, I think it was a week or 2 weeks, they had already filled up their allotment. They were going to tap out of their grant funding too quickly. And so they had to stop enrollment after a couple of weeks. And so again, here, another example of like, is there a way that we can partner with Habitat to figure out ways to help with home repair? We often, when we do home visits on behalf of Penn State Health, as you can imagine, there are, significant households in the surrounding community that are in disrepair. And I think of a great example of someone that we saw who had not been seen over 5 years in the clinic, had multiple health concerns that we were able to sort of chip away at, but her front steps were falling apart, and she had no railing on her front doorstep, so she couldn't even use it, had to use a back door. And so I just think of, how much can we potentially prevent by, fixing her stairs would go a long way at preventing a hip fracture than anything that we could do medically for that patient. So much of, I think, what the Lion Mobile Clinic is trying to do is tackle some of those problems that we're seeing in the community. And again, align sort of this academic, community-based organization partnerships and whatever we can to leverage resources. Again, sorry, Ted, I feel like that was a long-winded response to the question. Hopefully that added a little bit to it.
Good answer.
Thanks.
And by the way, I'll just I'll add to that. There's already an existing relationship between you mentioned Lions clubs, and from community to community, like one town, the local club may be the Lions clubs that's really active. The next town over, it may be Rotary, but an existing network of relationships is very strong between Children's Miracle Network and the Lions clubs of Pennsylvania. They already have a very good working relationship. So
it's great. Thanks.
Sure.
Oh, and thanks, Brad. Brad was just putting in the chat too. So another example that also, would be open to other people's thoughts too. I think we've been able to partner with the library system here in Center County. So it turns out that library systems across Pennsylvania, there's a system in place that essentially requires there are like 4 or 5 programs that if they are able to host, I think it's called the STAR program, that they will get certain recognition from the state. And so one of those happens to be about health literacy. And so we've really seen this, is there a way that we can partner with the library system to provide services that exist, but then also be there for other research opportunities. And so we've had students that have been hosting a health literacy course at some of our local libraries that provide things like, they'll read during story time for the little kiddos about healthy eating, and then we're outside the mobile unit giving out flu shots. So provide sort of this combination of service and sort of stepping out of the mobile unit to be available for any health questions. So another sort of system that we're hoping to sort of leverage, and an idea too as we expand to think about as a pillar in the community that may be able to partner to provide health information.
Mike, this is Brandon. You're absolutely correct on the STAR program.
Thanks, Brad.
So I'm from more of a communications background, and so this may be like a duh comment, and you've already done this, but I pass through Snowshoe on my way to our cabin every year. We're in Cinemahoning, different county, but not far at all. And they struggle with very similar challenges as far as access, and even, proper internet. I mean, you can barely connect to the internet. It's very limited. But I have found that there are Facebook groups that have thousands of people that are members of, and I know they're not necessarily focused on like the hot topics or anything political. It really is truly happenings, what's the latest news, and that's where a lot of people are getting their information, including people external that are coming in as hunters. But it might be something at least to be aware of and join, just to know what people are talking about, and maybe an opportunity to share resources on those pages as well. Just a thought.
Yeah, thanks, Ellie. It's such a good point. I think Facebook seems to be the #1 social media avenue for a lot of rural communities, and so too Snowshoe has its sort of private page that has information on it. I think we've been, when we first went there, we sort of didn't have willing party to allow access to utilize it. But as we started to get to know the community more so, then we were able to utilize it as a resource. I think what we also found is that sometimes it's almost like, and maybe there's probably a better marketing term to describe this, but someone had mentioned this concept of a sticky message. Like, what's the sticky message that goes in the community that tells you about this potential resource? And I think what we found is that it was actually what we found, at least in this community, is the older adults in the senior center that spread the sticky message better than any other resource. So we go and we park outside the old medical center that no longer has a clinic, no longer has the pharmacy or the dental office, but the senior center is still active in the basement. And it took us a while, but at one point, and I don't remember when this was, I see Jen's on here too, Kolkowski, she might remember. But at some point, one of the seniors said, "You guys do a really crappy job of advertising." And really, what it was that they had been keeping pulse of what was happening, and we were like, "Great, tell us what we should do." Part of that was having them help us spread the message. So I think there's the Facebook web page has been really helpful to get the awareness out for people that can access it. For those that can't, I think what we found is the sticky message, like who's in the community that can talks to so and so when they're getting gas, or is around town at this church event and shares it there. Really this concept of like community ambassadors. It took a while to figure out who those people were. And this is probably, for others that do work in communities, different that you talk to the local politicians or the township supervisors. They may not be the people in the community that can really spread the word. I think we found that out pretty soon after we got there. And then it just took some time to figure out who could be the people that would share the sticky message. So we were fortunate enough that it was the older adults that house the senior center, which are a fun group. But other communities, there are others, and so that just happened to be the main source.
So in the chat, Bradley Long suggested the Nextdoor app, and I don't know if we ever tried that at Mike, but that's an excellent one.
Yeah. It's interesting, Brad. The other thing that we found, again, maybe a challenge in rural communities is the lack of access to smartphone devices. So one of the events that we need to host at the senior center is that they had asked us, we have this coffee talks with future docs. The medical students will talk about a health topic. One of the requests was how to use their cell phones. So definitely, there's a technology gap there that exists. Now that doesn't say though, Brad, I hear what you're saying, with a community that has lost so much and has become, many communities that have come together closer, there are people within that community that can help to spread the word that could utilize that type of technology to tell their neighbor. So you're right, that could be a great resource.
Yeah, and even community ambassadors would maybe the ones who would go on it, and they'd see like, say they're just over, just outside of Snowshoe, but real quick drive over, and they see it on something like that, then they can come on over.
Yeah.
I don't know if you saw in the chat, Dr. McShane, but Amy Caputo wrote about how for her research that they actually have a dedicated phone line and email for their specific project. Has the mobile health clinic thought about anything like that, or is that something in the works?
Yeah, no, that'd be great. Yeah, I think so. We go out to some of the dairy farms as well, and I think probably the way that so we go out to the dairy farms to primarily provide primary care services to migrant and seasonal farm workers. And the way that we've been able, so we were initially at these farms introduced to the farm workers by the farmer who had a relationship with the extension in some way. I think what we found is that, there are certain dynamics that exist because of that hierarchical relationship that can affect the willingness or success of different health programs. So we actually started a WhatsApp group for those farms specifically to relay information that could sort of, I don't want to say bypass the farmer, but be able to be connected to the community to see what those needs might be. But those have been separate from it, and it does make a lot of sense. Is there some way that could have a phone line or another method of communication that can be a little bit easier for those that may not have other methods to either use the greatest technology of the mobile devices, or maybe better with a landline. And I'll mention one thing too about connectivity. And Brad, I think you know about this too, is that when we talked to one of our local libraries has had a grant in place to provide Wi-Fi hotspots for community members. The problem with it is that you rent out for about 3 months. They're such a hot item that they often will rent out again. If someone rents it out, they will immediately sign up again to get that hotspot. So it just shows the limited connectivity that exists in a lot of these rural communities, and ones that aren't really that far from our campus. So we're talking about a library that's maybe 20 minutes from the main university. And yet, there are people that are accessing that library that have limited connectivity for the internet. That's to me is troubling. And so figuring out ways that we can help with connectivity so that people can access things like Facebook or other community forums to then know what's happening in those communities.
And that's a community where geography actually plays a factor in internet connectivity too, because they're on the other side of Mount Nittany.
Oh, thank you, Bonnie. Bonnie Kent said for advertising in a rural area, and especially for those who are digitally disadvantaged, using yard signs is a great way to go. They're also cost effective. That's a really great point as well.
Yeah, Bonnie, I know you've got tons of experience in this lane. I'd love to hear your thoughts, and I tell you, it doesn't go a week doesn't go by when I get a little sass from the older adults in the senior center for not dragging out. We have like this one sign that says, the mobile clinic's here today. To put it out by the road. I usually get in trouble for not dragging the sign out. But Bonnie, that makes tons of sense. You have other ideas for getting the word out?
Yes, actually, we've done a number of events where we actually put stickers on pizza boxes. Looking at a diverse group of individuals in the community, we have those that are digitally illiterate, have no access. We have our different age populations that, we're trying to reach out to. So from stickers on pizza boxes to the roads, yard signs, which really are the most successful for us, to asking people who send out utility bills, like our water bill or our boroughs, if they would put us in their newsletters or just a little insert. We've had grocery stores who've put inserts in the grocery bags for us. That's been really successful for us. The yard signs, I want to tell you about our initiative, Valley Strong. When we wanted to roll that out, we were like, how will we really get this message across? So we engaged our local radio station, and we played a game of yard sign tag. And so I would give you a sign, ask you to put it on your property for 30 days with a one-sheeter explaining what Valley Strong is all about. And then you would tag somebody in 30 days. And we saw a shift of 200 signs moving in the community all over cornfields. In planter boxes. I mean, you name it. They were just shifting all over the place. And then our radio station, they would select somebody every week to give a prize to that they they found one of the yard signs. So it was a lot of fun, but it really started the conversation about what our initiative was all about and got the word out. So I hope that will help.
That's amazing, Bonnie. Yeah, I'll tell you. And you know, it's I think what we're learning is it's sort of those little things of trying to figure out ways to spread the word, get the sticky message out, and connect people that have, you know, that may not have access to the other resources that are available in the community. So I love that. I love that. It's great.
Agreed. Such a creative and you know, such a simple, fun thing to do while you're spreading the word. That's great. Thank you, Bonnie.
May I just add, if you can find a community mobilizer or liaison in that area, that person will have a list, a network of key leaders who will open doors for you.
Thanks, Bonnie.
Well, thank you both so much for this presentation and engaging discussion. If there's no other questions, I think we could probably leave a few minutes early today to give you all a bio break before your next meeting.